Hi, Mr. Chulak. Apology in advance. I couldn't get the Echo Show thing to work, but usually I just upload via YouTube and make it public, so hopefully it won't be any issue to find my video. But sorry in advance, I'm shooting on my phone. The article that I've chosen to discuss in my video essay is a case study regarding pressure-controlled continuous mandatory ventilation, so PCCMV for short. CMV modes are commonly used in critically ill patients in respiratory failure. These patients require the synchronization of patient effort and vent-given breaths, which is really important because, as we talked about in class, falling outside the synchronization window is a little tricky. Get into it more as I go on. CMV modes allow mandatory breaths and assisted breaths, which have different triggers. So mandatory breaths are triggered by time, according to frequency, according to our set respiratory rate, while assisted breaths are triggered by patient effort, which kind of looks different per patient. I, for one, in the beginning while we were kind of learning this, struggled to grasp how assisted breaths and mandatory breaths could coexist within the same cycles, meaning that assisted breaths affect our set frequency, which kind of throws off our ideal cycle time, and time is a reflection of pressure. So, it's just a little bit strange. Which is what I thought was really interesting about this case study, what kind of drew me to it, because this case study kind of talks about a possible solution to that problem, which I think is really neat. So the solution that they're proposing is increasing the inspiratory pressurization to lower the patient's work of breathing. So I think that would mean to increase the flow upon inspiration, kind of changing the IDE ratio, to avoid vent complications like breath stacking and the patient falling outside of their synchronization window. Kind of to try to lower the patient's effort. It kind of sounds like lower it to nothing, but just to avoid them breathing over our settings on pressure control. So appropriate pressurization is really important for patient comfort. It's argued by a lot of people that high and low pressurization can cause different levels of discomfort for different reasons. So it's important to kind of find the optimal in between. I personally imagine breath stacking to be very uncomfortable and probably a risk for barotrauma because, the increased airway pressure and whatnot. So if a higher inspiratory pressure can help me to avoid that complication, I think I'd find that comfortable by all means. So this case study examined 5 different vents on model lungs. Vents including 2 that we're pretty familiar with, being the Hamilton G5 and the Servo U. The other 3 I'm sure that I've seen but wasn't as familiar with. The Puritan Bennett 980, the Aveda Infinity 4500, and Avea, AVEA. So each vent was tested with its maximum and minimum pressurization ramp settings with both strong and weak patient efforts to kind of see the correlation between each, since patients sometimes have strong, weak, whatever. It was noted, though, that each vent had different capabilities of ramp pressure. I'm not personally familiar with what that actually is on a vent. I haven't really seen it being used, but this is a reflection of tidal volume, but specifically on the inspiratory effort. So it was found amongst all vents that there was a decrease in patient effort with the higher inspiratory pressure, an increase in airway pressure, and a decrease in instances of breath stacking. However, as I said, each vent had different pressurization ramp setting capabilities. One of the main advantages of the PCCMVs, or CMV in general, is the avoidance of barotrauma because the pressure is continuously monitored. But this method was noted to increase the risk of barotrauma, as I'd mentioned, because it's an increase in pressure, so hyperinflation of lungs and things like that. It was still a really interesting read and a neat approach to solving a vent complication such as that. I think that as we kind of continue learning vents, that I could take a lot more from this article, but it was a little bit tricky to comprehend. Either way, super cool. I look forward to talking more about it. Thanks.